Hello and welcome back to my channel. I'm Nurse Alyssa and today we're going to be talking about Mextra Superabsorbent cover dressing. But first, if you could hit that like and subscribe, it would be greatly appreciated as it does help my channel grow. So let's get started. So Mextra Superabsorbent, it is a 4-layer flexible dressing designed to contain a high amount of exudate. So this is for wounds that are draining an extreme amount, okay? So we don't want to use this on our low to moderate draining wounds. There's other dressings for that. This is for our high amount of exudate, okay? So it is a hydrophilic wound. It has a hydrophilic wound contact layer with a repellent backing. So this prevents fluid strike through. And the core, it's designed in a way to have a high retention capacity. So this also minimizes chances of maceration around the peri-wound and in the wound. This dressing, it is designed in a way that it cannot be cut. So like I previously said, we're going to be using this product on wounds with large to copious amounts of exudate, and you can use this under compression. So sometimes when we have like venous disease and our legs are very swollen and they're draining that copious amount, it just keeps tearing out, you can use this under compression so we can get that drainage under control and the leg compressed so we can get that fluid moved out of the leg. Contraindications, so it does say on the packaging that we're not going to be using this on untreated clinically infected wounds. So that's just like any product. We have to make sure that we're using our nerds and stonies, making sure that the wound infection, if there is an infection, is treated appropriately. And then this, as long as we're treating the infection, we can be using this product. It goes for any wound care product that doesn't have an antimicrobial property. It always says that on the packaging, not to be using it on untreated clinically infected wounds. So we just, every time we're doing a dressing change, we're always assessing our nerds and stonies for infection. I will put a link in the description for our nerds and stonies video, just in case you're not sure, but it's how we check for if a wound just needs a topical or if it needs a antibiotic, and we use nerds and stonies to be able to differentiate. So how we use this cover dressing, we're going to make sure that we are cleansing the wound first before applying. So using your sterile water or sterile saline. We're going to pat the peri-wound dry, and we are not going to be using a skin barrier with this product, okay? It says that we should not be using skin barriers. Now to apply, we can either use this as a primary dressing or a secondary dressing. So what that means is if you need a contact layer on the wound, you can use a contact layer. Now just make sure that it's not going to interfere with the absorbing properties, because we want to make sure that that exudate, because it's draining a lot, can get through to that cover dressing, or it's going to cause maceration. So whatever you decide, if you are using it as the cover dressing with an interface in between, you want to make sure that the exudate can go through it to that cover dressing, or it's kind of pointless and you're going to have maceration and the wound will break down, okay? So this dressing, you're going to have the white side down against the skin and make sure that that is covering at least 2 to 4 centimeters overlapping the peri-wound, okay? So you have your wound and you're going to have your bandage around it, okay, by at least 2 to 4 centimeters so that any exudate can be spread into that, and it's not going to be touching the wound at all. It gives it some extra room for the exudate. Okay, and then you're just going to either tape it on, or I personally like to put cling around and then tape that. Okay, so however you like to um, fixate it onto the skin, you can do that. So to remove this dressing, you're just simply going to either remove the tape or the cling from the peri wound. Now, the expected outcome of using this is that the exudate is being managed with no peri-wound skin maceration, okay? So we want to make sure that the peri-wound does look very well. It's not turning white. It's not breaking down. That's our goal of using this. Now, the frequency of dressing change it's completely going to depend on the amount of exudate coming out. So when it does fill and it is getting to that maximum amount of exudate in there, it needs to be changed, okay? Now it does come in a bunch of different sizes. So right here, like I said previously, we cannot cut these bandages or they will not work properly, okay? It does have like a fluid lock, so you cannot cut this. So make sure that you're using the right size pad for the wound. Now, with that said, make sure that it is covering at least 2 to 4 centimeters onto that peri-wound tissue, okay? That's all I have for this video. I hope it does help you in your daily practice. And if you haven't done so already, I would truly appreciate if you did subscribe to the channel and hit the like button. I'll catch you in my next video, guys. See ya.